Any difficulty in study? Relax. Dental Anupam is here. Today discussed about the most important chapter for tooth morphology, that is terminologies in tooth morphology. Overview. Each has two parts, crown and root, separated by a cervical line or cemento-enamel junction. Each tooth is composed of following surfaces: facial surface, proximal surface, masticatory surface, palatal or lingual surface. The crown and the root are traditionally classified into three thirds: cervico-occlusally, faciolingually, and mesiodistally for description purpose. The anatomical landmark in the crown are the cusp, tubercle, lobe, cingulum, ridge, fossa, groove, sulcus, and pit, while anatomical landmark in the root are apex, apical foramen, root trunk, and furcation area. Now go to the introduction. The subject, tooth morphology, involve the study of the anatomical topography of teeth. Learning about the terminologies is important to understand the subject in a better manner. Parts of a tooth. Each tooth has two parts, crown and root, separated by a cervical line or cemento-enamel junction. First is crown. The crown is the portion of the tooth which is covered by enamel. The crown portion may have an incisal ridge or edge. In the case of an incisor or a single or two or more cusps, in the case of canine, premolar, and molars. Based on the position of the crown in the oral cavity, two types of crown terminologies are used. First one is anatomical crown and second one is clinical crown. Anatomical crown. It refers to the crown which is covered by enamel, regardless of whether it has completely erupted or not. The size of the anatomical crown remain constant throughout the lifetime of the tooth, except in case of attrition or any other physical wearing of the tooth surface. Clinical crown. It refers to the crown which is visible clinically when looking into the mouth. The height of the clinical crown is determined by the position of the gingival margin. The clinical crown may be smaller than the anatomical crown, such as in a newly erupted tooth, where only a part of anatomical crown is visible and the cervical portion of the crown is still covered by gingiva. The clinical crown can also be larger than anatomical crown in case where there has been recession of the gingiva with root exposure. Root. The portion of the tooth covered by cementum is known as root. The root may have either a single root or multiple root. Single root are seen in anterior teeth, mandibular premolar and maxillary second molar. Multiple root are seen in molar and premolar. In maxillary, first premolar and mandibular molar, two root are present, and in maxillary molar, three root are present. Bifurcation or trifurcation is the term used for the division of the root into two or three segments. That is, bifurcation is seen in maxillary first premolar and mandibular molar, and the trifurcation is seen in maxillary molars. On basis of whether the root is visible in oral cavity, two type of root terminologies are used. First one is anatomical root and clinical root, as anatomical crown and clinical crown. What is anatomical root? Anatomical root refer to the root that is below the cemento-enamel junction and is covered with cementum, a bone-like substance that facilitates encourage of the tooth in its bony socket. The size of the anatomical root remain constant throughout the lifetime of the tooth, except in case of resorption of the root. Clinical root. It refers to the part of the tooth that is under the gingiva and not exposed to the oral cavity. The height of the clinical root is determined by the position of the gingival margin. It may be longer than the anatomical root, such as in newly erupted teeth, where the part of the crown that is non-erupted is considered part of the clinical root. It may also be shorter than the anatomical root in elderly persons, where there is gingival recession and part of anatomical root is exposed to the oral cavity. Now go to the cervical line. The cervical line separates the anatomical crown from the anatomical root. It is the junction between the two tissue of the root, enamel and cementum, and hence is also known as the cemento-enamel junction. This is region of the tooth is also called the cervix of the tooth because it appears constricted between the crown and the root portion. Now go to the structures of the tooth. The tooth comprises hard tissue and soft tissue components. The three hard tissue components are enamel, dentin, and cementum. And the one soft tissue component is the pulp tissue. The hard tissue are mostly inorganic or calcified with a large mineral content. They surround the soft tissue as a protective covering except at the apical foramen area. Enamel. Enamel is the hard, highly mineralized, protective, white, shiny structure covering the outermost layer of the anatomical crown. It is the hardest substance in the human body. It does not contain living cell. So it is incapable for remodeling or repairing. Enamel is composed of 95% mineral content, calcium hydroxyapatite, 4% water, and 1% enamel matrix or organic matrix. The color of the enamel depend on two factors, mineralization and the thickness of the enamel, and can range from grayish white to yellowish white. Enamel developed from enamel organ by formation of a specialized type of epithelium cell called ameloblast, and the process of enamel formation is known as amelogenesis. Dentin. Dentin is the hard, mineralized, yellowish tissue present in both the crown and root. It makes up the major bulk of the tooth. Is present beneath the enamel and cementum and line the pulp cavity. The dentino-enamel junction separate the enamel and dentin, and the cemento-dentinal junction separate the cementum and dentin. Dentin is composed of 70% mineral content, 12% water, and 18% dentin matrix, and hence is softer than enamel. It develops from the odontoblast, which are specialized cell that developed from the dental papilla. The process of formation of dentin is known as dentinogenesis. Odontoblast line the pulp and are capable of remodeling or repairing by forming secondary and reparative dentin. Now go to the cementum. Cementum is mineralized, dull, yellowish tissue covering the outermost layer of the anatomical root, extending from the cervical line. The cemento-enamel junction is the junction between the enamel and the cementum. The cementum protects and anchors the tooth in the alveolars through the attachment of the periodontal fiber. The cementum is composed of 65% mineral content, 12% water, 23% organic matrix, thus softer than enamel and dentin. It developed from the dental sac by specialized type of cell called cementoblast. and the process of cementum formation is known as cementogenesis. Pulp. Pulp is the soft tissue present in the central innermost portion of the tooth called the pulp cavity. It is completely covered by the dentin layer except near the apical foramen. The apical foramen is the opening of the pulp cavity near the apex of the tooth through which the blood vessels and nerves enter the pulp. The pulp is divided into two part. Cornal pulp, which is present in the crown portion, and reticular pulp, which is present in the root portion. Pulp developed from the dentin papilla, which and is composed of connective tissue, nerve, and blood vessels. It has formative, sensory, nutritive, and protective function during the life of the tooth. Supporting structures of the tooth. The supporting structure of the teeth are collectively known as the periodontium, which help in attaching the tooth to surrounding tissue as well as allowing the sensation of tooth, sensation of touch and pressure. The periodontium consists of cementum, periodontal ligament, alveolar bone and gingiva. Of this, the cementum is the only structures that is a part of the tooth. First one, alveolar bone. The root portion of the tooth is fixed firmly within the tooth socket of the jaw called the alveolar with the help of periodontal ligament. The portion of the jaw which anchors and supports the teeth is known as the alveolar process or alveolar bone. Periodontal ligament. The periodontal ligament developed from the dental sac and is composed of periodontal ligament fiber attached to the alveolar bone on the side and the cementum of the tooth on the other side. Gingiva. The crown portion and sometime part of the cervical cementum is partly covered by soft tissue of the mouth known as gingiva or gums. Surface of the teeth. In addition to identify and naming teeth, it is important to name the tooth individual surfaces. The surfaces are named according to their position in the oral cavity and also based on their uses. The number of surfaces of a tooth is different for anterior and posterior teeth. Anterior teeth, those closer to midline and comprise central incisor, lateral incisor and canine. They have four surfaces: labial, palatal or lingual, mesial and distal, and one ridge, incisor ridge. Posterior teeth are those away from the midline and compressed premolar and molar. They have five surfaces: buccal, palatal, lingual, mesial, distal, and occlusal. Facial surface. The surface of the tooth nearest to the cheek or lips is referred to as the facial surface. The facial surface can be subdivided into labial surface and buccal surface. Labial surface. It is the facial surface closest to the lips and is present in the anterior teeth. Buccal surface. It is the facial surface closest to the cheeks and it present in the posterior teeth. Palatal surface. In maxillary arch, the surface of the tooth closest to the palatal is termed as palatal. Lingual surface. In the mandibular arch, the surface of the tooth closest to the tongue is termed as lingual surface. Now go to the proximal surface. The surface of a tooth that is towards another tooth in the dental arch is termed proximal surface. The proximal surface can be divided into two surfaces on the basis of position in relation to the medial line of the face. The medial line is an imaginary line on the medial sagittal plane that bisects the dental arch at the center. Each tooth has two proximal surfaces, mesial and distal. Mesial surface, the surface that towards or closer to medial line of the face. Distal surface, the surface that is away or distant from the medial line of the surface. The mesial surface of all teeth contact the distal surface of the adjacent teeth, except between the central incisor where the mesial surface contact the adjacent mesial surface. In permanent third molar and deciduous second molar, the distal surface has no contact with any other tooth. Masticatory surface, the surface that aids in chewing is known as the masticatory surface. The masticatory surface is subdivided into the occlusal surface in the posterior teeth and the incisal surface in the anterior teeth. Occlusal surface, it is the chewing surface of the posterior teeth that articulates with an antagonist tooth in the opposing arch. Incisal surface, it is the cutting surface of the anterior teeth in newly erupted teeth. The incisal surface appeared rounded and narrow, and it termed incisal ridge instead of incisal surface. When the incisal ridge become flat due to wear and tear, it is termed incisal edge. Division of the surfaces of the teeth. For purpose of description and for locating the various area on a specific tooth surface, The crown and root are arbitrarily divided into thirds and are named according to their location. Division of the crown into third. The crown can be divided into third in three ways: cervico-occlusally or cervico-incisally, faciolingually, mesiodistally. The cervico-occlusally, the facial, lingual or palatal, and proximal surface of crown can be divided into third, cervico-occlusally, by equally spaced horizontal line. They are divided into occlusal third, middle third, and cervical third. Faciolingually, the proximal surface of the crown can be divided into third, faciolingually, by equally spaced vertical line. The division are follows: facial third, middle third, palatal or lingual third. Mesiodistally, the facial and lingual or palatal surface of the crown can be divided into third, mesiodistally, by equally spaced vertical line. The division are follows: mesial third, middle third, and distal third. Division of root into third. A root can be divided into three thirds in the following three ways: cervicoapically, faciolingually, mesiodistally. Cervicoapically, the facial, lingual or palatal and proximal surface of root can be divided into third, cervicoapically, by equally spaced horizontal line. The division are follows as cervical third, middle third, apical third. Faciolingually, the proximal surface of the root can be divided into third, faciolingually, by equally spaced vertical lines. The division are follows: facial third, middle third, palatal or lingual third. Mesiodistally, the facial and lingual or palatal surface of the root can be divided into third, mesiodistally, by equally spaced vertical lines. The division are follows: mesial third, middle third, distal third. Now go to the line angle. A line or point where two or more surface border meet is known as an angle. A angle is an angle formed by junction or union of two surfaces, and the name is derived from both the surface. For example, the junction between the labial and distal surface is termed is distolabial line angle. The anterior teeth have 6 line angle and the posterior teeth have 8 line angle. Line angle means two surfaces are meet. Point angle. A point angle is an angle formed by junction or union of three surfaces, and the name is derived from the three surface. For example, the junction between labial, mesial and incisal surface is termed mesiolabio-incisal point angle. Now go to the anatomical landmark on the tooth surface. Elevation, depression, groove are present on the surface of the teeth, and Different terminologies are used to describe those landmarks. Some landmarks may be used in identify a particular tooth. Hence, it is necessary to know about the individual landmark on the tooth surface. Anatomical landmark on the crown surface. Cusps. A cusp is an elevation on an occlusal surface of posterior teeth and canine. It contributes to a significant portion of the tooth surface and divide the occlusal surface of the posterior teeth. It is present on the occlusal surface of molar and premolar teeth and on the incisal edges of canine. Each cusp represent the developmental lobes of a tooth. The cusp contribute to a significant portion of the tooth surface. Each cusp have four cusp slope or ridge and an apex. The cusps are named according to the location on the tooth surface. The number of cusps may be varying according to the type of tooth. Canine have one cusp, maxillary premolar and mandibular first premolar usually have two cusps. Mandibular second premolar may have either two or three cusps. Maxillary molar have four cusps and mandibular molar have four or five cusps. Tubercle. A tubercle is a small rounded prominence on the surface of the tooth resulting from the extra formation of enamel. Tubercle are usually deviation from the normal form. For example, the cusp of Caraveli is a tubercle. The cusp of Caraveli is a fifth cusp present on the palatal surface of the maxillary first molars. Cingulum. The cingulum is a bulge or elevation on the lingual surface of incisor or canines. It is the lingual lobe of the anterior teeth and makes up the bulk of the cervical third of the lingual surface. The term cingulum comes from a Latin word remaining gradle, since it encircles the lingual surface of the tooth mesiodistally in the form of gradle. Lobe. A developmental lobe is the growth center in the development of the crown of the teeth. Each tooth begin a developed from four or more developmental lobes and they appear as cusps and mamelons on the tooth surface. Deciduous incisor developed from one lobe and deciduous molar developed from five lobes. Permanent anterior teeth, maxillary premolars and mandibular first premolars developed from four lobes. Permanent mandibular second premolars and permanent mandibular molars developed from five lobes. The permanent maxillary molars developed from four lobes. Mamelons. Mamelons are the protrusion seen in the incisal edge of newly erupted permanent incisor teeth. They represent the three lobes from which the labial surface form, and they are separated by a developmental groups. Ridge. Ridge are any linear flat elevation on the teeth, and they are named according to their location or formation. Several specific type of ridge can be identified. Those are labial ridge. It is the ridge running cervico-incisally approximately at the center of the labial surface of the canines. It extends from the cusp tip to the cervical region of the tooth. This ridge is very prominent in maxillary canine as compared to mandibular canine. Buccal ridge. It is the ridge running cervico-occlusally approximately at the central of the buccal surface of the premolars. It extends from the cusp tip to the cervical region of the tooth. This ridge is very prominent in the first premolar compared with the second premolars. Incisal ridge. It is the present in the incisal portion of newly erupted incisor, where the incisal surface is rounded and the merge with the mesio-incisal and disto-incisal angle and the labial and lingual surfaces. Lingual ridge. It is the ridge running cervico-incisally approximately at the center of the lingual surface of the canine. It extends from the cusp tip to the cingulum in the cervical third, thereby dividing the lingual fossa into two parts. This ridge is also more prominent in maxillary canine than in the mandibular canine. Linguo-incisal ridge. It is the ridge running mesio-distally in the lingual surface at the incisal third. Cervical ridge. It is the ridge running mesio-distally on the cervical third of the buccal surface of the crown. It is found on all primary teeth and on permanent molars. Marginal ridge. It is a linear rounded border of enamel that forms the mesial and distal margin of occlusal surface on posterior teeth, and the mesial and distal margin of the incisor and canine lingually. In anterior teeth, the marginal ridge run vertically in the cervicoincisal direction, and in posterior teeth, those run horizontally in the buccolingual direction. Cusp ridge. It refers to inclined surface or ridge that forms an angle at the cusp tip. Cusp ridges are termed as cusp arms. Triangular ridge. Triangular ridge is the ridge descending from the tip of the cusp of molars and premolars towards the central part of the occlusal surface. In cross section, those ridges are more or less triangular and hence are termed triangular ridge. Those are named according to cusp to which they belong. Transverse ridge. It is a type of ridge that crosses the occlusal surface of posterior teeth transversely and is created when the buccal and lingual triangular ridge join. Oblique ridge. It is the ridge that crosses the occlusal surface of the maxillary molar obliquely. It extends from the triangular ridge of distobuccal cusp to distal cusp ridge of mesiopalatal cusp. Now go to the fossa. What is fossa? Fossa is a irregular rounded depression or concavity found in the lingual surface of anterior teeth and occlusal surface of posterior teeth. The point of convergence of the ridge and the junction of the grooves from the depression or fossa in the posterior teeth. Different type of fossa are as follows. Lingual fossa. Lingual fossa is found on the lingual surface of the anterior teeth. It is bounded by the lingio-incisal ridge, cingulum and marginal ridges. In canine teeth, the lingual fossa is divided into two by lingual ridge running cervico-incisally. Central fossa. It is a major fossa found in the occlusal surface of the molar teeth. Distal fossa. It is a major fossa found in distal to oblique ridge in the occlusal surface of the maxillary molars. Triangular fossa. Triangular fossa is a minor fossa founded mesial as well as distal to the marginal ridges on the occlusal surface of premolars and molars, and it termed mesial triangular fossa or distal triangular fossa depend on its location. Mesial triangular fossa is seen in distal to mesial marginal ridge and distal triangular fossa seen in mesial to distal marginal ridge. Sulcus. Sulcus is a long linear depression or valley in the occlusal surface of the posterior teeth, the inclines of which meet at an angle to form a developmental groove. Now go to the what is developmental groove. Developmental groove is a sharply defined narrow and linear depression from during tooth development, usually separating the lobes or the major portion of the tooth. The various types are follows. Central developmental groove. It is the groove separating the occlusal aspect of posterior teeth. Buccal developmental groove. It is the groove separating the buccal cusp on the occlusal aspect of molar teeth and extending onto into the buccal surface from a short distance. Lingual developmental groove. It is a groove separating the lingual cusp on the occlusal aspect of maxillary molar and mandibular molars and mandibular second premolars. The lingual developmental groove extends into lingual surface for a short distance. Supplemental groove. It is a shallow linear depression, usually less distinct and more variable than developmental group. It does not mark the junction of the lobes or the major portion of a teeth. Pits. Pits are small pinpoint depression, usually seen in the fossa of the posterior teeth. They are found at the end or cross section of developmental groove. Pits are named according to their location. First one is central pit. It is the found in the central fossa on the occlusal surface of molars, where developmental group join. Buccal pit. It is the found on the buccal surface of molars, where the buccal developmental group terminate. Lingual pit. It is the found on the lingual surface of molars, where the lingual developmental group terminates. Mesial pit. It is the found in the mesial triangular fossa on the occlusal surface of premolars and molars. Distal pit. It is found in the distal triangular fossa on the occlusal surface of premolars and molars. Fissures. A fissure is a sharp surface between the cusp and ridge, formed because of the faulty union of the enamel of the different lobes. It is formed below the developmental groove. Contact area. Contact area or point are the crest of curvature on the proximal surface of two adjacent teeth in the same dental arch that come in contact with each other. In newly erupted teeth, the contact is small in size and is termed contact point. As age advances because of constant movement of proximal surface, the contact become broad and termed contact area. Each tooth has two contact points, mesial and distal, except for deciduous second molars and permanent third molars, which have only one contact point, that is mesial. In each tooth, the position of the contact point varies: incisal or occlusal third, middle third, or the junction of middle and incisal third. Contact point or area have specific function. First one is stabilize the tooth within the alveolus, prevent food incompaction, protect the interdental papilla. Now go to the interproximal space. The interproximal space is the triangular or V-shaped space cervical to the contact area. The proximal surface of adjacent teeth forms the side of the triangle. The contact area from the apex and the alveolar bone from the base of the triangle. This space is usually filled by interdental papilla from the gingiva. In case of gingival recession, the interproximal space transforms into the cervical embrasure as the interdental bone, and the interdental papilla does not fill up that space. Now go to the embrasure. When two teeth in the same arch are in contact, their curvature adjacent to contact area from V-shaped spine-ways space or triangular space known as embrasure. The main difference between the interproximal space and the embrasure is the interproximal space are filled with the interdental gingiva, whereas embrasure are empty space adjacent to the teeth. Now go to the anatomical landmark on the root surface. First one is apex. The terminal end of the root portion of the tooth is termed as apex. Apical foramen and accessory foramen. The apical foramen is the opening of pulp canal at the apical end of the root through which blood and nerve supply pass into the pulp canal. The accessory foramen is a channel leading from the root pulp laterally through the dentin to periodontal tissue. It may be found anywhere on the tooth root but is more common in the apical third of the root. Root trunk. In multi-rooted teeth, the undivided cervical portion of the tooth is termed as root trunk. Furcation. In multi-rooted teeth, the division of the root is termed furcation. This is called bifurcation if the root is divided into two parts, or trifurcation if the root is divided into three parts. Thank you.